evening, everyone. My name is Dr. Karen Bender. I'm a naturopathic doctor and registered nurse from Whole Health Wellness Center. We'll begin our webinar on cardiovascular disease and the discussion around treating the root cause right on the hour. So in the meantime, while we're waiting for some more people to join, go ahead and feel free to introduce yourself in the chat. And perhaps let us know what your dream vacation would be, just while we wait a few more minutes for some more participants to start and join us. All right, I'm going to start in about another minute or so. If anyone is having trouble hearing, or someone could just let me know that they can hear me okay in the chat, that would be great. Okay, thanks. You can hear me great. All right, so I'm going to go ahead and get started. It's just now 7 o'clock, so welcome everyone who's joining us tonight. For those of you who joined a little bit later, I'll go ahead and introduce myself again. My name is Dr. Karen Bender. I'm a naturopathic doctor as well as a registered nurse at Whole Health Wellness Center. So today we're going to talk about cardiovascular disease. I'm just going to introduce the topic to clarify what is cardiovascular disease, just starting out. And then I'm going to discuss some of the causes that contribute to the development of cardiovascular disease. See abbreviated there, CVD, but I will go ahead and say cardiovascular disease just for clarity. And then, of course, what can be done to prevent and treat cardiovascular disease. And then at the end, a discussion about how you can make an appointment or a free discovery call to learn about more ways that you can protect your health or treat any risk factors that you might have. To start out, so the definition of cardiovascular disease, in a broad sense, it is a class of diseases that involve the heart and the vascular or blood vessels involved. So most people, when they're talking about or refer to cardiovascular disease, they're talking about coronary artery disease, such as angina or chest pain, myocardial infarction, more commonly known as a heart attack, and also stroke. There's other diseases that fall under the umbrella of cardiovascular disease, and you'll see a list there under the tab that says these are also cardiovascular diseases, so things like rheumatic heart disease, abnormal heart rhythms. But for the sake of this discussion, I'm going to primarily focus on the conditions that affect or related to coronary artery disease and can lead to heart attack and stroke. So cardiovascular disease, again, referring to the umbrella term, is the world leading cause of death worldwide. There is one exception in the continent of Africa. It's not the leading cause of death, but when you take into account everywhere else, it is. In 2015, it was the cause of 32% of deaths, and that is an increase from 25.8% just a few years before that. So it is on the rise, and it is definitely a big issue but the good news is that there's a lot of things that people can do to affect their risk factors, and we're going to get into that. So here's the question. Most people think of cardiovascular disease, especially with coronary artery disease, and there's some understanding about cholesterol as a marker to help us assess what is going on and what our risk factors are for cardiovascular disease. So my question, I'd love to have some feedback in the chat if anyone wants to volunteer their thoughts on whether cholesterol is good or bad. So I'll give you just a moment to go ahead and type in what you think there. Just the first thing that comes to your head. Okay, no one wants to volunteer an answer, so I will go ahead and just say that I'm thinking it's possible that some of you are thinking that it's bad, because most people, when they hear that word in the context of health, they think of high cholesterol and they think that it is bad or something that needs to be addressed and fixed. And so in some ways, this is a bit of a trick question because, people might think it's bad, but I want to talk about some of the things of why cholesterol is so important, okay? Just to kind of counteract some of the bad reputation that it's gotten, possibly. So you'll see here pictured in this graphic, cholesterol in the upper left, and that's showing that cholesterol is the backbone or the starting point of many other hormones, many of the other steroid hormones. And you'll see there, the ones you most likely recognize would be cortisol, estrogen, and testosterone. So cholesterol is the backbone of all of those, and is needed to make those other hormones that have vital functions in the body. So just keep that in mind when you think of cholesterol. It's also the backbone of vitamin D, which is important for many things: immune function, mental health, bone health, as well. But cholesterol is also a component of the structure of the membrane of every cell. It's what allows the cell to be fluid and flexible so that it can function well. When there's not enough fat or cholesterol in the cell, it's more rigid and it's unable to have the same ability to absorb nutrients, the same ability to have the receptors that for various hormones function properly. So it's also important for cellular structure. Speaking of which, myelin sheath on nerve cells is also made from cholesterol. So the myelin sheath is like the insulation around the nerve cell that helps make the nerve conduct its electrical impulse through the body so that nervous system functions well. When you have problems with the myelinization, you start to have a lot of neurological problems. The other thing that cholesterol is really important for is that it is bile salts are made from cholesterol. So bile salts are made in your liver, stored in your gallbladder, and are really important for breaking down those fats that allow us to absorb fats from our diet, but also fat-soluble vitamins like vitamin A, vitamin E, vitamin D. So that's another important role of cholesterol in the body. And the one that's probably least commonly known is that cholesterol actually acts as a free radical scavenger, meaning that when you have oxidative damage in your body from various processes, that cholesterol actually goes around and counteracts that oxidative stress and quells it. So those are just some examples of how cholesterol is good. But then there's the other side of cholesterol. And so just breaking that down, you have your total cholesterol, which is a combination of your LDLs and your HDLs and other components of cholesterol. LDL is the one that often people think of as the bad cholesterol. It's the number when that's high, we want to get it down. And the reason why is it is when it's in abundance, it actually can, or when there's too much of it, it can actually cause oxidative stress and damage the vessels of the blood, which allows the development of these plaques that lead to coronary artery disease. And there's a picture a little bit later on, I will show that to you. But because the LDLs transport the cholesterol into the tissues, that's why they can be problematic. They're bringing the cholesterol into the bloodstream. The HDLs remove the cholesterol from these plaques and help prevent cardiovascular disease. So that's the one that we want to make sure it's at least above 50. And then there's the ratio of the HDL with the total. So we want to look at the whole picture there, and we want to see that the ratio is below 5 and ideally more like 3.5. So as I was mentioning before, atherosclerosis is a condition where we have these plaques. So you can see in that blood vessel, it's been narrowed by these plaques that build up. How those initially start is by some kind of damage to the epithelial or the lining of the vessels, of the blood vessels, that then causes these lipids to get into that, under the membrane of those cells and be oxidized, leading to the buildup of these plaques that then get calcified and harden, which narrows the flow of blood, which is going to limit the oxygen delivery and nutritional delivery to the cells, because it's a matter of plumbing. That's a narrow passageway. And when those become completely blocked, if there is a clot that forms on those plaques, or if there's just an embolus that's going through the bloodstream, then you get a complete blockage, which leads to a heart attack or myocardial infarction or a stroke, and when that blockage occurs in the brain. So those are definitely things that we want to prevent the buildup of and have nice open patent lumens, as you would say, of the blood vessels there. All right, so when it comes to the development of these plaques, we really want to treat the root cause, okay? So what are those? Well, when you look at the statistics, the cause of deaths from cardiovascular disease, there's a breakdown of percentages. The number one culprit is high blood pressure. And that is mostly due to just the mechanical force of high blood pressure over time damaging those arteries, leading to more need for, or more damage to the arteries can cause more plaque formation. More oxidative stress than building those plaques. The other one would be smoking tobacco, diabetes, lack of exercise, obesity, and then high cholesterol, poor diet, and excessive alcohol consumption. So what I want to point out is that what do all these factors have in common? And the answer is chronic inflammation. So when you think about obesity, fat cells are going to be releasing cytokines that cause more inflammation in the body. More inflammation in the body is damaging to those vessels, leading to those plaque formations, okay? Tobacco smoke or any kind of smoking also has a lot of free radical damage that causes that stress and damage to the epithelial cells of the vessels, also leading to plaque formation. Diabetes, high blood sugar. The sugar, when it's too high, causes oxidative stress, which leads to the damage of those blood vessels, leading to the development of the plaques and atherosclerosis. So, and then some of the other factors like lack of exercise and high cholesterol Those are or the lack of exercise. It can affect the fitness of the vessels, their ability to vasodilate or widen or narrow, and then also just sedentary lifestyle can lead to some other things like diabetes, like obesity, which all contribute to this. So going back, so the conventional medication that is used to address high cholesterol is statin medications. But I just wanted to point out the way that these work is they inhibit the body's production of its own cholesterol. So the majority of cholesterol is actually made in the body. Okay, hold on. I'm getting a message that that there's some problem. Well, I think that's just one person. So maybe I'll let the moderator handle that. I'm sorry. So if anyone else is having trouble hearing me, please go ahead and let us know in the chat, but I'm going to keep on going. So with the statins, I was just saying that the way they work is they inhibit the production of cholesterol. So therefore lowering your risk of heart disease just because of the fact that the cholesterol, when it's too high, does damage those vessels. It's one of the many factors that can affect the damage of those vessels, leading to the plaque formation. But as I stated in that other slide, there are many other factors that can lead to the damage of those vessels that also need to be addressed. So just by lowering the cholesterol is not treating that underlying inflammation, that underlying oxidative stress is happening in those vessels, leading to the plaque formation. And so other than just looking at cholesterol as a risk factor, there's many other things that can be looked at. So homocysteine is a substance, it's a byproduct of some biochemical processes that can build up when there's inadequate B12 and folate in the body. And this substance is damaging to the vessels and can increase clotting. The other one, there is a marker called HSCRP, and it's just a general marker of inflammation. So if this is high, then we know that there's more inflammation in the body, which equals more oxidative stress, which equals more potential for buildup of these plaques. Uric acid, another indicator of oxidative stress that can be leveled. And then you'll see ASCVD score. So this is a calculation based on a variety of factors: your cholesterol level, age, your blood pressure, whether or not you're a smoker, and if you have diabetes. It factors in all of those and gives you kind of a score to assess your risk of a cardiac event, whether it be a stroke or a heart attack in the next 10 years. So that's another tool. Evaluating for elevated blood sugar and also insulin are good markers for seeing risk for diabetes, but also let us know if there's too high of blood sugar over time. It can contribute to the damage of those blood vessels as well. Fasting insulin is an even more sensitive marker than blood sugar. It's not always checked, but it is a really good way to catch diabetes before it even develops, and when it becomes sometimes it can be insulin resistant that then turns into diabetes. So I like to check that one because it's even earlier of a predictor of risk factors. The next one is gut inflammation. So any kind of inflammation can contribute to damage to these blood vessels. A big culprit that's often not looked in conventional medicine is inflammation coming from the gut. Whenever you have disturbances in the microbiome or the good bacteria of the gut, this can cause endotoxins to get into the bloodstream that then cause inflammation. So even if you're not having symptoms related to digestive distress, such as constipation, diarrhea, heartburn, gas, and bloating, you might still have some inflammation in the gut. So it's always good to look there as well. The next one is heavy metals. Many of people are exposed to heavy metals or have accumulated heavy metals over the course of their lifetime, and they may not be aware of it. There's many different sources of it that you could have been exposed to and not even know. So the only way to know is if it's accumulated in your body is to test your urine to find out. The reason why this is important in cardiovascular disease is it sometimes can be the underlying cause of hypertension or high blood pressure. The next two are ApoA and ApoB, these are proteins, lipoproteins that are associated, that kind of give us another indicator of how your cholesterol levels might be influencing your health. So ApoA is associated with HDL, which is, again, the good cholesterol. If you don't have enough of it, your risk factor for cardiovascular disease increases. And then the opposite is true of ApoB. It's more associated with LDL, the quote unquote bad cholesterol that is bringing the cholesterol into your tissues and is associated with increased risk of cardiovascular disease. And then the last one is just evaluating for visceral fat. So visceral fat has more inflammatory properties than other fat in your body. It's the fat that can be around your organs. And so the best way to evaluate for that is a body impedance scan, a painless way of sends a little electrical impulse through your body and lets us know how much of your body weight is fat versus skeletal muscle, and then also how much fat is around your organs. So it's a good indicator of letting us know, besides just looking at your weight as a number, it looks at and breaks it down. And so we often recommend people do a body composition analysis as part of their overall health assessment. I already covered that slide. So again, here's just the factors of how chronic inflammation contributes to cardiovascular disease, but then also just as a reminder, or not necessarily a reminder, but just to point out how chronic inflammation contributes to so many other chronic illnesses, from cancer to diabetes and other metabolic disorders, chronic pain, mental health conditions, neurological conditions. So it's really important to figure out and assess for excessive inflammation and then treat it. So here we're talking about cardiovascular disease, and an ounce of prevention is worth a whole pound of cure. And so here's just a couple basic things that can be done to help prevent cardiovascular disease. Some of these are fairly common knowledge at this point. There's been a big effort to educate the public around this, but there's a few in here that maybe you haven't heard of. So of course, eating a well-balanced diet full of fresh fruits and vegetables, and limiting processed food and refined carbohydrates, trans fats, and sugars from the diet can help with having healthy cholesterol. Carbohydrates and processed sugars are more influential on raising cholesterol levels than fats themselves. Exercise, of course, trying to get at least 150 minutes a week of some kind of exercise. You can get a little bit less time-wise if you do more vigorous exercise, but definitely consistency is important. Avoidance of tobacco smoke, again, that's related to the oxidative stress that causes to your blood vessels. Excessive alcohol intake can also, alcohol is a toxin in the body, and it does require quite a bit of effort on the body's part to detoxify from it. And so sometimes if you're taking in more alcohol than your body can process properly, it also takes away from the ability of your body to detoxify from other toxins that are ubiquitous and all over the environment. So limiting alcohol intake is important as well. Addressing other risk factors, just keeping your blood pressure at a healthy level and your cholesterol at a healthy level, and also avoiding high blood sugar with diabetes. Addressing chronic inflammation. So that was, I can go into a little bit more detail when I talk about some of the things you can do for interventions, therapeutic interventions there. A lot of sources of chronic inflammation can come from the gut, can come from excessive body weight, from the visceral fat, from toxins in the environment, chronic infections. So another thing that you can do for prevention then again would be regular detoxification. So there's things that your body does naturally on its own to detoxify. But again, with detoxification, I like to think of it as kind of like you have a bucket, and you can put so many things in the bucket, and then maybe there's a hole in the bottom that drains out the excessive toxins. But if you keep on putting too much in the bucket, eventually it's going to overflow the other end. So that's when you start to have symptoms of chronic inflammation that can be anywhere from brain fog to joint pain to muscle aches, headaches. There's skin rashes. There's a lot of different symptoms that can happen when your body is overloaded. Sensitivity to smells, sensitivity to chemicals that are other signs of being overloaded with toxins. So by doing things to support toxins, doing a nutritional supported detoxification with certain supplements that can really help support both phases of detoxification can be really important to do on a regular basis. Also things like taking a sauna, sweating is one of the #1 ways that your body detoxifies, another added benefit of exercise. And then, of course, just limiting your exposure to toxins that can cause oxidative stress and damage to the blood vessels as well. So figuring out getting your water tested, perhaps getting your home tested for molds, things that can cause chronic inflammation. Also, maybe getting your urine tested just to see, do I have an accumulation of heavy metals? And then where are they coming from so that I can take those out of my daily exposure. Also things like the things you put on your body, the lotions, the shampoos, the different things that your skin is very absorptive, and so you want to be really careful what you put on your skin and in your body in terms of how that contributes to your toxin load. And then maintaining a healthy weight. So many of these factors, such as eating healthy, exercise, good sleep, stress management, all play into that. There's many things that can get in the way of getting a healthy weight in terms of hormone balance and stress levels, sleep, that all should be assessed. That should also be assessed trying to figure out your treatment plan. And of course, I just sort of touched on stress management, but that can definitely affect cardiovascular disease. I will talk about that a little bit more on one of the future slides. Okay, just in terms of, so those are some more of the lifestyle factors. So here are some examples of some therapeutic things that can be done in natural medicine to help prevent and treat cardiovascular disease. So I will kind of go through them, and then I have some other slides in a little bit that explain some of them a little bit more. But red light therapy, so this is a therapy I have another slide for, so I'll save that information for that. SPMs, or specialized pro-resolving mediators, those are molecules made in your body that help to resolve inflammation so that it goes from so it can be resolved and not become chronic and problematic. That it can also be taken in a supplement form. I have another slide that kind of takes a picture of that to explain. Taking omega-3 fatty acids or eating fish on a regular basis also pushes the body towards a less inflammatory state, making cytokines that are less inflammatory. And so that is a really health preventative thing to do. I recommend that people take a fish oil as just kind of a base supplement, partly because it protects brain health, mental health, immune function, as well as cardiovascular health. There's just so many benefits from taking it. I recommend most, if not all, people be on some form of fish oil. Anti-inflammatory herbs, there's so many of these. So one example that comes to mind that many people think of is turmeric. That's one example, but there's also many others. Especially one to think about is the culinary herbs, things like garlic, rosemary, thyme, oregano. These all have a lot of very potent antioxidant effects that can be benefited from in your diet as well as a supplement. Then you have things like vitamin E, or annatto E is a specific form of E that has been shown. It's from the annatto plant. It's a form of vitamin E that has been shown to be very helpful for helping to counteract some of the bad effects of oxidative stress on the vessels in cardiovascular disease. And then niacin helps to also lower cholesterol. CoQ10 is a coenzyme that is found in the body. It's ubiquinol is another term for it, which means it's everywhere because it's in all of the cells. It's very important for metabolism. It's also very important for countering oxidative stress. And then that is something that is depleted actually with statin medications. So that is something that is really important in the body, but also very important to take if you are taking a statin medication. Magnesium, many people are deficient in this. Part of the reason is even if you're eating a pretty good diet, many of the vegetables that are grown in conventional ways are not as nutrient dense as they used to be, but conventional farming practices have depleted a lot of nutrients from the fruits and vegetables, so some people can be deficient in magnesium. Having a healthy magnesium amount helps support many enzymatic processes in the body, detoxification being one, but also maintaining healthy blood pressure is really important. Plant sterols are cholesterol-like compounds found in plants that help to compete for the absorption of cholesterol. So when taken in the diet, they will make it so less of the cholesterol is reabsorbed from that comes from your bile, but also that comes from your diet. And then again, I mentioned supportive detoxification. Oops, wrong way. Supported detoxification, things like sweating, nutritional supplements that support, and dietary supplements that are dietary changes that help support detoxification can also be done. This is just a slide to sort of point out the steps of acute inflammation. So a couple weeks ago, I did a presentation on chronic inflammation and how it is problematic. So in inflammation, we have the initiation phase or the acute phase. That's when the healing occurs. The problem is when it doesn't completely resolve, that inflammation response can become damaging. So the SPMs you'll see in this chart or on this picture here in the little blue circle there is molecules that help to resolve inflammation so that it doesn't become chronic, and that can be taken as a supplement to help with that process. Again, just another picture about antioxidants and free radicals, how we have these free radicals that can come from a variety of different sources, high blood sugar, cigarette smoke that we were talking about, also just some other toxicants that we come in contact with in the environment on a regular basis, as well as some of the chemical processes, the biochemical processes that happen in the body that produce free radicals. So antioxidants, we want to have a balance of a match of those antioxidants to match the free radicals so that we don't have as much oxidative stress on the body. Okay, so red light therapy, I mentioned earlier, it's one of the therapies that we offer at Whole Health Wellness Center that we're very excited about because there's just so many different uses for it because it affects inflammation on a cellular level. It is a medical device registered with the FDA for helping to reduce inflammation. And the sessions that we do are 15 minutes. You get inside of this full body treatment apparatus, and you have 15 minutes where you're surrounded by this red light that can really penetrate into your cells and offer a relaxing 15 minutes, but also have a really deep therapeutic effect of helping to reduce inflammation. And then this is just kind of another slide explaining how it works. So it reduces inflammation by working on the mitochondria. There is a picture of a mitochondria. It's an organelle that's present in every cell of the body, and it is basically the powerhouse of our cells. It's what makes ATP, which is the energy currency of our bodies. And when we boost the energy production, we are able to have faster cellular turnover in our cells so that they are then able to have a quicker healing cycle, which helps to resolve inflammation and promote healing of damaged tissue. So overall, reducing inflammation, improving cellular health. Okay, so this slide is a picture trying to depict biofeedback. Biofeedback is another modality that I use in my practice to help teach people stress management techniques. So what it does is you use a sensor to detect your heart rate variability, basically how your heart rate goes up and down in response to the environment and also to your thoughts. And by learning how to do some different breathing exercises, you can see how you can shift your heart rate variability. So on the left, you'll see when you're in a state of frustration, stress, your heart rate is going up and down in a really erratic fashion. When you start to have thoughts of gratitude and appreciation, your body is in more harmony and the heart rate is going up and down in a nice even fashion. And there's been studies to show how this can improve blood pressure, Can also improve digestion, ability to concentrate, improve sleep. It really just brings more harmony to the nervous system so that it can function optimally. So I bring it up in the context of cardiovascular disease because learning these techniques and experiencing how by learning some simple techniques of breathing and practicing this on a regular basis, you can shift your body to be more resilient in the face of stress, helping to maintain healthy blood pressure that can help reduce your risk for cardiovascular disease, as well as many other health benefits from doing that. Okay, so now we're kind of nearing the end of the presentation, and I just want to be encouraging about some of this information. Hopefully you learned something and you feel more curious about what you can do, some other steps that you can do. So maybe it kind of set off a few bells, or maybe it made you think of cardiovascular disease in a different way. That has inspired you to take action and think about what other things has been missed for me in terms of what assessment pieces have not been done that I now want to have done. Was we really want to focus on treating those causes and not just the symptom. Okay, we don't want to just give the statin and forget about it. We want to figure out what is the dysfunction here and what can we do to eliminate the root causes. And then also, it's very personal what those things might be for you. And so as a naturopathic doctor, my job is to sit down and listen to your full story and take in all the information and figure out what is the best plan for you as an individual, and addressing all the different parts that contributes to your picture of what symptoms you have and what your concerns are, and addressing the physical and also the emotional components of all of that. And incorporating and understanding the importance of stress management as part of that, and then also feeling supported by medical staff, myself, and our support staff. So just hopefully that is something that is making you feel inspired. And if that didn't inspire you, then maybe this little puppy can. This is my golden retriever puppy, Happy. And I like to put it here just to kind of encourage, like, what is your why? What are you able to live your purpose? Like, are you feel like what you're doing in your life, how you feel now, is really allowing you to live the fullest, or there's some things that you feel like you really want to address and have some improvement with, and so that you can really live your purpose there. And so now, I'd like to give you an opportunity to book a free call. So you should see a button that will give you an opportunity to book a discovery call with me, that will give you an opportunity to just ask any questions that you might have. Perhaps naturopathic medicine is something that is new to you, and so perhaps you want to just hear a little bit more firsthand of what that means and what it could mean for you. And also give you a chance to kind of just tell me a little bit about your health concerns and see if you think that naturopathic care would be a good fit for you, and then make a plan for your first appointment. What kind of things do I want to know from you? What can you do to best prepare for it? So you should see that button, and hopefully you can sign up for that and feel empowered to take the next step. And then just so you have a little bit more information, if you decide to book a first appointment, what you can expect is that we can do that appointment in person, or we can do it virtually. It's kind of up to you, what you feel more comfortable with. We accept most insurances. I went ahead and listed those there. There are some exceptions, so if you don't see yours listed there, still feel free to give a call to the office. The one you can see in the chat there, some of the details of the insurances that we accept. And then also just know that the first visit is an hour-long visit. That's to give us enough time to really do a thorough consultation and get your full health history and devise a personalized plan for you. All right, so together we can change your life. I hope that this has inspired you. I hope that you give me a call and I get to have a conversation with you and just learn a little bit about what your concerns are and how we can get started on addressing your whole health. So thank you very much for attending this webinar this evening. It's been great having you. I hope to see you again. I'm doing a variety of different webinars and also have a blog there. Feel free to check out on our website from Whole Health, different articles that I've written, and stay tuned, and I hopefully see you again soon. So thanks again, and have a wonderful night.